My name is Dr. Christopher Gay. I'm a board-certified anesthesiologist and interventional pain medicine specialist. I spent years treating patients whose pain started exactly the way yours may have, in a car accident, after a fall, a moment they didn't see coming. Now, if you're watching this in the hours or first few days after an accident, I want to say something to you directly. This is the most important window of time in your entire recovery. Not because you need to panic, you don't, but because the decisions you make and the actions you take or don't take in the next 72 hours will shape everything that comes after: your healing, your documentation, your case. So let's talk about what's happening right now and what you should do. First, the adrenaline effect. Right after an accident, your body floods with adrenaline and cortisol. These are stress hormones, and they do something remarkable. They temporarily mask your pain. They're part of the fight or flight system designed to help you survive a threat, not to accurately report your injuries. That's why so many accident patients say they felt fine at the scene, walked away, drove home, and then woke up the next morning unable to turn their head or get out of bed. The absence of pain in the first hours is not evidence that you weren't hurt. I cannot say this clearly enough, because the exact misunderstanding costs people their health and their cases every single year. So what should you do in the first 24 hours? Number one, get a medical evaluation. Even if you feel okay, go to an emergency room and an urgent care center or call your primary care physician. You don't need to feel terrible to need documentation. You need a medical professional to assess you, note your presentation, and create a record that links the incident to the date. That medical record is the foundation of everything. Without it, there's a gap, and gaps get exploited. Number two, document your symptoms yourself. Use your phone, record a voice memo, take notes. Write down every area of your body that feels even slightly off: stiffness in your neck, soreness in your shoulders, a headache, pressure anywhere. Include things you might dismiss as minor. Write the date and the time. Do this once on day 1, once on day 2, and once on day 3. These personal records, dated and time-stamped, can be remarkably useful later. Number 3, don't minimize to anyone. Not to the other driver, not to the police officer, not to the insurance adjuster who calls you tomorrow. Do not say you're fine. Do not say it was minor. You don't know yet. Say, I'm going to get evaluated. Now, what about reporting the accident? If police responded, a report was likely filed. If not, for example, in a parking lot incident or a slip and fall, file one yourself if possible, or make a written record of what happened, where, when, and who witnessed it. If there are surveillance cameras, they should be noted and preserved. If your attorney is already involved, tell them immediately. Footage disappears quickly. The 72-hour window matters for another reason. Certain injuries, soft tissue injuries, disc injuries, ligament sprains, don't always produce immediate imaging findings, but the clinical documentation of your initial presentation, your pain levels, your range of motion, that picture changes day by day. The sooner a provider sees you, the more complete that initial record is. Studies on whiplash and rear-end collision injuries consistently show that patients who receive early assessment and treatment have better long-term outcomes than those who waited. This isn't just about your legal case. It's about your body. So what to expect in the coming days? Day 1 through 3, adrenaline fades, inflammatory response begins. You may feel worse before you feel better. This is normal and does not mean you're catastrophically injured. It just means your body is doing what it's designed to do. Day 3 through 7, peak soft tissue inflammation. This is typically when pain is at its most intense and most descriptive. This is also when people seek care, but by then some of the acute documentation window has closed. So if you haven't been seen yet, go today. Not tomorrow, today. Now, before we close this module, one more thing. The way you think about these first 72 hours matters. You're not trying to manufacture a case. You're creating an accurate medical record of a real event that happened to your real body. That is not just your right, it is your responsibility to yourself and to everyone who will help care for you. Seek care, document everything, say nothing you don't know to be true. Now, in the next module, we're going to talk about the anatomy of what happens to your spine in a crash, because understanding that will help you understand every symptom you're about to experience. I'll see you there.